Have you ever found yourself waking up multiple times during the night to use the bathroom? Or maybe you've noticed that even after urinating, you still don't feel that sense of complete relief? These are experiences so many men go through, yet most brush them off as just another inevitable part of getting older. But here's what I want you to know: these symptoms aren't something you simply have to accept. They're signals from your body, and today I'm going to share with you insights that could genuinely transform how you feel every single day. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon. And if you've ever had questions or concerns about your urological health but felt too hesitant to ask, please know you're in the right place. We're here to help you understand your body with clarity, compassion, and without judgment. Today, we're going to talk openly about prostate health, a topic many men are curious about, but find incredibly difficult to bring up even with their doctors. The truth is, millions of men around the world share these same concerns. Through years of caring for patients in my practice, I've learned something important. With the right approach and small, thoughtful changes, these issues can improve significantly. Let's be honest, prostate health is a topic most of us would rather avoid. It feels embarrassing, uncomfortable, and deeply personal. But here's the good news. Even a few simple adjustments to your daily routine can dramatically reduce strain on your prostate and help you reclaim restful, uninterrupted nights. Before we dive in, I want to encourage you, if you have questions, experiences, or concerns, please share them in the comments. Your voice matters, and when we talk openly about these important but often avoided subjects, we make it easier for others to do the same. So let's begin. Let's explore why your body is sending you these signals, and more importantly, what we can do about it together. The hidden danger of holding it. In one thing, I can say with absolute certainty after years of seeing patients is this: prostate. Problems aren't just about age. The small everyday habits we barely think about can place surprising strain on the prostate, and over time, these habits can contribute to enlargement and discomfort. Let me give you a common example: holding in your urine. Whether you're in a public place, at work, or simply too absorbed in what you're doing to pause, each time you delay that trip to the bathroom, you're placing unnecessary pressure on your bladder and prostate. Once or twice might not seem like a big deal, but when this becomes a pattern, your bladder gradually stretches, your prostate experiences repeated strain, and eventually, this can lead to serious urinary problems. Think of it like a balloon. At first, it seems fine, but if you keep inflating it beyond its limit, it loses elasticity and stops functioning the way it should. Your urinary system works similarly. So, whenever you feel the urge, please respond to it. Don't tell yourself, I can wait a little longer. This one simple shift, listening to your body, can significantly reduce prostate strain and improve nighttime urination frequency by up to 40%. It also helps prevent urinary tract infections. Remember, the discomfort you feel is your body's way of speaking to you. Don't ignore it. Pay attention. Catching issues early and making small adjustments is the best way to protect both your quality of life now and your long-term health. A question I hear all the time now: let me share something really important with you. Recently, I received a comment on one of my videos from a patient in his late 60s. He shared that after self-stimulation, he noticed he wasn't ejaculating, and he felt too embarrassed to ask me directly. So a family member reached out on his behalf. His partner was worried too. I want you to know, I hear questions like this constantly, but so many men feel too ashamed or uncomfortable to ask their doctor face-to-face. So today, I'm going to address this clearly and scientifically. This is one of those questions many men think about but rarely voice. It's one of the most sensitive topics when it comes to prostate health. Does self-stimulation actually help prostate health, or could it be harmful? Especially if you're over 60, this question has probably crossed your mind at least once. Most men find it incredibly difficult to discuss this with their doctor because of embarrassment or shyness. But please, don't worry. Today, I'm going to share real, science-based information. No taboos, no judgment. Let's move past labels of good or bad and simply explore what truly benefits the prostate and what might cause harm. Understanding your prostate, knowledge takes away fear. Let me start by explaining what the prostate actually is. The prostate is a small gland, roughly the size of a walnut. It sits just below the bladder and wraps around the urethra. Its primary job is to produce fluid that nourishes and protects sperm. As men age, the prostate can enlarge, sometimes slowly, sometimes more quickly. When it grows, it can make urination difficult, cause frequent nighttime bathroom trips, and increase the risk of more serious conditions. So what's the connection between self-stimulation and prostate enlargement? In 2016, Harvard University published research that followed nearly 30,000 men for almost 20 years. The results surprised the medical community. Men who ejaculated 21 or more times per month had a 33% lower risk of prostate cancer, compared to those who ejaculated 4 times or less per month. And this wasn't a one-off finding. Studies from Australia and Europe showed similar results. Why does this happen? The prostate produces fluid every single day. If that fluid stays inside the gland for too long, toxins and old cells can accumulate, potentially triggering inflammation. Regular ejaculation helps refresh that fluid. Essentially, it cleanses the system. Other benefits include stress reduction, lower cortisol levels, support for cellular regeneration, improved pelvic blood circulation, and optimized hormonal balance. But balance is key. For most men, once a day is neither harmful nor excessive. In fact, it can be beneficial. However, if it becomes compulsive or excessive, it can lead to fatigue, discomfort, or nerve strain. Listen to your body. Do you feel energized or drained afterward? Are you doing this for relaxation, or does it feel like a compulsion? If your body is sending warning signals, it's time to pause and reassess. 3 daily habits that can transform your prostate health. Now let me share 3 simple daily habits that can genuinely make a difference for your prostate. These might seem small, but when practiced consistently, their impact is profound. First, strategic hydration. This may sound basic, but the impact is far greater than you'd think. As we age, our sense of thirst weakens. Many men unknowingly drink far less water than their bodies need. The result? Concentrated, acidic urine that irritates both the bladder and prostate. But here's the key. It's not just about drinking more water. It's about distributing your intake wisely throughout the day. Here's the prostate-friendly hydration strategy. Drink water in small, frequent sips during the morning and afternoon. Gradually reduce intake after 4 p.m. After 7 p.m., drink only minimal amounts. Large-scale studies involving thousands of men have shown that this simple approach reduced nighttime urination frequency by 41%. Second, the miracle of post-meal walking. This might also seem insignificant, but the benefits are real and measurable. A gentle walk after meals improves blood circulation to the pelvic region. This means more oxygen reaches prostate tissue, which reduces inflammation by 35%, accelerates metabolism, and helps regulate blood sugar, preventing diabetes-related complications. Research from the University of São Paulo found that men who walked just 10-15 minutes after meals experienced 35% fewer prostate enlargement symptoms. Again, this small habit supports both overall health and prostate health. You don't need to run a marathon, just a comfortable 15-minute walk after lunch and dinner. Third, regular, healthy sexual activity. Yes, this is still a sensitive subject for many men, but the science is clear. Regular ejaculation clears stagnant prostate fluid, reduces inflammation by 40%, relaxes pelvic nerves, improves localized blood flow, lowers prostate cancer risk by 33%. Harvard's long-term study confirmed that men who ejaculated 21 or more times per month had significantly lower prostate cancer risk. Beyond supporting prostate function, regular sexual activity helps maintain hormonal balance. Don't be ashamed. Talk with your partner. This is a health issue, not just about pleasure. Your diet matters more than you think. The 4th habit involves your diet, and it truly has a major impact on prostate health. Many men don't realize that what they eat directly affects their prostate, but the right foods can reduce inflammation, protect tissue, and significantly lower disease risk. Prostate superfoods. Lycopene, a powerful natural antioxidant found in tomatoes, watermelon, and guava. Multiple studies show that regular consumption can reduce prostate cancer risk by up to 28%. Pro tip: tomatoes cooked in olive oil release 3 times more lycopene. Cruciferous vegetables, broccoli, cauliflower, and cabbage contain sulforaphane, which supports natural detoxification, protects cellular DNA, and reduces inflammation by 35%. Zinc, found in pumpkin seeds, oysters, seafood, and nuts. Zinc is essential for hormonal balance and maintaining the structural integrity of the prostate. What to absolutely avoid? Processed meats increase inflammation. Excessive sugar disrupts hormones. Excessive dairy consumption linked to benign prostatic hyperplasia. Your ideal daily meals should be colorful, plant-rich, and balanced. This is your natural medicine for the prostate. Sleep, the hidden key to prostate health. The fifth habit is something many men overlook, but it plays an absolutely critical role in protecting the prostate. Deep, restorative, high-quality sleep. Sleep isn't just essential for mental and physical recovery, it's necessary for maintaining hormonal balance and the health of prostate tissue. During deep sleep, our bodies produce anti-inflammatory melatonin, release powerful natural growth hormone, repair and regenerate tissue. Research tracking 40,000 men over 10 years found that those with sleep disturbances were twice as likely to develop aggressive prostate cancer, experienced 3 times more frequent urination symptoms, had 4 times higher systemic inflammation. How to optimize sleep. Keep your room dark, cool, 18 to 20 degrees, and quiet. Avoid screens an hour before bed. Blue light destroys melatonin. Maintain a regular schedule, even on weekends. Avoid heavy meals, caffeine, or alcohol in the evening. Use relaxation techniques, meditation, or deep breathing. Sleep isn't a luxury. It's when your prostate repairs, regenerates, and protects itself. The synergy effect, when all habits combine. Now we've reached the most important part. Let me explain how all these habits work together to create real, meaningful change for prostate health. Your prostate is like a quiet guardian in your body, working silently behind the scenes to maintain your well-being. If we ignore even its smallest signals, they can develop into far more serious problems. When you combine all 5 habits, cancer risk decreases by 50%, urinary symptoms improve by 65%, quality of life improves by 80%, nighttime awakenings are significantly reduced. These signals might start as minor inconveniences, a slight change in urination frequency or flow, but left untreated, they can progress into serious conditions. Your personal action plan. Transform your prostate in 30 days. Week 1, lay the foundation. Start strategic hydration today. Take a 10-minute walk after lunch. Track your daytime and nighttime bathroom visits. Week 2, accelerate. Add cooked tomatoes to 3 meals this week. Add an evening walk after dinner. Buy pumpkin seeds. Week 3, optimize, have an open discussion with your partner, optimize your bedroom for sleep, eat cruciferous vegetables daily. Week 4, transform, evaluate your progress. You'll see visible changes, adjust based on results, celebrate your renewed vitality. There is hope. The question of whether prostate issues can be treated, the answer is yes, there is hope. But early diagnosis combined with a healthy lifestyle is absolutely essential. If you're experiencing symptoms like frequent urination, weak urine flow, a feeling of incomplete emptying, or pain and discomfort, don't wait. Seek consultation immediately. Early intervention saves lives. The habits you've learned today are among the most natural, effective, and scientifically proven ways to protect your prostate. Integrating these habits into your daily life improves not only your prostate, but also your overall happiness, energy levels, and quality of life. Remember, the small steps you take today can create tremendous positive change tomorrow. Take care of yourself. Listen carefully to your body's signals. Don't ignore them. When these healthy habits take root, monitoring your prostate health becomes entirely within your control. I especially want to thank those of you who've asked questions in the comments. To the patient in his late 60s who asked about reduced semen, this is something so many men wonder about. In the next video, I'll address these questions in greater detail. We'll talk about how semen volume changes with age, when it's normal, and when you should see a doctor, and how to have these conversations with your partner. Stay healthy, everyone. Your best life is waiting for you.